Well, hello, everybody, and welcome to another episode of the Informed Chiropractor. This is Dr. Don MacDonald, your host. I have a return guest, and she hasn't been on the program, I think, for 8 years. I think it was even called a different name. We've met this guest, must have been probably close to 20 years ago or 15 years ago or something, somewhere around there. She's like the most renowned researcher in chiropractic in our model in the whole world, and we're so happy to have her in our profession. And I'm excited to have her on the podcast so we can talk about all the different disciplines, figuring out why chiropractic is so amazing. So, everybody, welcome to the call, Dr. Heidi Haavik. Welcome.
Thank you, thank you. Thanks, Don. I love talking with you and Brandy. It's just, we have so much fun. We never shut up. So
I know. And the problem is we haven't seen each other in real life for way too long. So,
I know, but it doesn't feel like that. Maybe it's because of social media and things like that. I just feel
that's
like I'm following what you guys are doing, and yeah.
yes. Well, we're going to be very excited because we're for sure in Calgary together on April 18th.
I know. How cool is that?
So all the listeners, you got to make sure you come to the New Zealand Lyceum in Calgary because that's going to be like a really cool seminar. We haven't had a cool multi-speaker seminar in our model in Alberta in like a long time, probably since the last time I put one on when I was doing that all the time. So it's probably been at least 15 years. So what I
Yeah, the
wanted to
New
do,
Zealand colleges, the New Zealand college is just taking off. It is unreal. Because I've heard of how well, most of the colleges in the US, their numbers are down and everything's going really badly. And for us, we've got the opposite problem. It's going so well. We're getting so many people that we're expanding. So we're literally looking at setting up a satellite chiropractic college now in Calgary.
I
So
know
it's super, super exciting.
that would be super exciting. We just got to wonder about timeline because like we'll be selling our practice in the next year, and so I got to figure out what I'm going to do.
Ooh,
I got to
ooh,
figure out what I'm going to
ooh,
do in
oh,
my semi.
that's interesting.
We're, our goal was, our joke was, we wanted to get away from the freezing cold Canadian winters.
Oh,
However, if there's an
right.
opportunity in Calgary to work there, who knows? Maybe that might be maybe a
Yeah,
possibility.
because you're not really going to escape the winters, are you? Although you would have to collaborate with the New Zealand College, so it might involve a little bit of travel to,
Yeah, and only
backwards and
in
forwards.
January, February to
I
go.
know, I know, I know. That's exactly what I was thinking.
That's funny. Okay, so we had to start recording because we were talking about all this stuff. I'm like, oh damn, we got to get this on recording. And so
Yeah.
we're talking a little bit because a lot of my listeners are very familiar with the polyvagal theory now and how we've kind of linked it. Well, basically, we're still talking chiropractic principles, so it's based chiropractic principles, except we're just putting it through a polyvagal lens, and we're just talking about how it's really cool to use different disciplines to help explain what we do as chiropractors because we are the weirdest profession in the world in health is that whatever we started 120 or 30 years ago just worked and now we're still trying to figure out to explain why it works.
Yeah, I know. Too funny. So we were chatting away before we started the recording, and we and we just got so into it, figured we got to start the recording now because we started talking about the polyvagal theory, for example. Because my best friend Erin Olson, she follows a lot of what you guys do, which is so cool. And then of course she asks me about it, and so she's got me rereading the book, and we're having because I did read it, many years ago as well, but now I wanted to read it through the lens of what I know as a neuroscientist. And it is so cool because so much of it is, it's like, very well proven science. But of course, there's still, he's a forward thinking scientist. And so he puts forward theories based on what he sees in the science. And that's exactly what we do in chiropractic research. Again, we base a lot of what we've done, it's based on very solid science now. And again, like we started talking about, for example, another whole body of research that fits very, very well is all this research by the spinal physiologists out there, like Hodges and Lorimer Moseley and all these guys. There's a whole, my technical term was shit ton of research that that looks at what happens when the spinal segments are injured or dysfunction. And you look at all of that, and I can break it down, and it just mirrors like a hand in a glove all the subluxation indicators. Like, so when the spine dysfunctions, you get this changes in intersegmental range of motion, you get this um, atrophying of these little muscles, and they become stiff and fibrotic. And what are we
And
palpating
fatty.
for? And fatty infiltrated.
Yeah.
But aren't we palpating for those stiff, fibrotic little muscles back there? And then, of course, because of the poor motor control, you get like little local swellings and the little tender bumps that we can feel, tender to the touch. These are all the classic clinical indicators of a subluxation. So, of
Mhm.
course, it fits so well And we've got to go down this track, Don, because there are people out there that still do like clinical trials worth millions of US dollars, which drives me nuts. And they might manipulate the spine 5 times and then conclude that spinal manipulation doesn't work or chiropractic doesn't work. And I'm like, no, it's the same as going to the gym 5 times and saying, oh, no, exercise doesn't work. That's bullshit, right?
Yeah.
Because they may well be manipulating just where someone hurts. It might be for low back pain patients. They might just be manipulating the low back. Or what if they've got a whopping upper cervical subluxation where all this dysfunction is? And so you're not getting the communication with the brain, so the brain can't control the lower back. Of course you're going to have, a screwed up lower back over and over again. But it's just, yeah, it's so beautiful when this large bodies of science fit so beautifully with this latest brain model of chiropractic, which now it's quite overwhelming. I mean, we know we're changing the brain when we're adjusting subluxations, and that is just so exciting to me.
And that's so funny because when I interviewed Dr. Stephen Porges, I talked about that, how we were very excited because we had getting all this brain research. So he said that's amazing. He said, but I think the main thing that's happening is because you're creating safety in the nervous system, like through safety cues, it's actually allowing the brainstem to open the trap door to the prefrontal cortex, right? And actually, we were talking about this before, is that even if you're doing research and you have 2 chiropractors giving an adjustment, I call it the safety sandwich. So the safety sandwich is before the adjustment, you make sure that they're safe in a state of ease and it's predictable and you're explaining what you're doing and you're regulated as a chiropractor. You perform your adjustment. And then you back end it with safety cues just to like either take it through range of motion or have them breathe instead of like sometimes on the videos now they're like pound them on the video and then they walk around and do like the moonwalk
I'm so
after.
amazing.
Yeah, totally. But if you did that compared to someone who just adjusted, like it's not going to affect the same. I like go tell me. I can tell you what. Tell me.
We're actually measuring this now, Don. We're actually measuring this now. Like we've literally, because in my team, my team, I don't know if you're aware, but our team has grown to over 35 people just in the research center. So I reckon we're probably the largest chiropractic research center on the planet that's actually studying chiropractic. But anyway, my main amazing bioengineer, Imran Khan Niazi, he's just phenomenal. If it wasn't for him, we wouldn't have 75% of what we've done so far. But anyway, him and another guy, Professor David White, who's actually moved from a local university to us. So can you imagine a non-chiropractor professor? He's going, nah, fuck this. I don't want to be at this awful university where I'm treated like an asshole, right? Yeah. I'm going to come here where I'm respected and treated like a human being. And anyway, together they've built this or created this autonomic nervous system measuring device. So we can actually see in real time when someone goes into sympathetic and parasympathetic. And not only that, we've recorded from the chiro at the same time. So we've recorded from
nice.
And from the patient at the same time. And we've gone through the whole process of so we must have been about 6 people over 3 weeks. So right through the history taking, right through the adjustment sessions, right through to afterwards. And it's unreal. So for the patient, for the patient who's getting adjusted, I mean, I'm big on it too, like really big on that they have to calm down. Because I think we'll be putting, if you're putting a force into a system that's in stress, it's going to go to different parts of the brain and have a different impact than if you're putting a force into someone who is in trust and feels safe with you and feels calm. So not only that, and then we've looked at specific individual components. So when we're doing a manual adjustment, we are setting off the sympathetic nervous system. And I think that's really, really important because I think this is what wakes the cortex up and it goes, shit balls, this isn't meant to be and that isn't meant to be and I should do that. And it resets itself. It's like a recalibration that takes place. But then when we were doing, like I was doing like a cranial adjustment, they were going right into parasympathetic. And I tend to end on that. It's like your sandwich again, right?
Yeah, yeah.
I tend to end on that. But the most fascinating thing to me, and I'd love your thoughts on that, is what was happening with my autonomic nervous system while I was adjusting these guys. Because I was all active during the conversation, but while I was adjusting them, I flatline. It's like I'm not there. I disappear. I don't know if I'm just a channel or like I'm gone. And then I'm back again afterwards. But
and actually, this is cool because this is where we can use some terms from the polyvagal theory, which is really cool, which is called co-regulation, right? And so when you are in a ventral vagal state, it activates your social engagement system, which is the five cranial nerves that make up all your facial expression, right? So that you can communicate with other people. And I can tell this too, is that when I adjust someone and you feel that release, like what it is, it's a co-regulatory. It's just like if I came up to you and I said, "Hi, how are you?" and give you a big smile, and then you give me a big smile back. And then
Yeah,
I feel even better, and then I give you a big
yeah,
smile. Like
yeah,
you kind of spiral up, or you can also spiral down, right? Like someone, if their social engagement system's offline,
yeah.
sometimes they say hi to someone, and then they're like, "What's wrong
And they
with
can
you?"
drain you, eh?
Yeah, and
Yeah,
so I think that's what's happening is that you get that you because we're so hooked into physiology, we can tell immediately when the physiology goes into ease that it automatically we go into ventral vagal, like boom, if you especially if you're present, like if you're in
yeah,
that present
yeah,
moment.
yeah.
So that might be a really cool way to explain what's happening.
Well, that's really, really interesting because we've now gone to the next level, and now we're actually recording whole head EEG from
Yep.
the chiropractor and the patient at the same time throughout chiropractic care. Because again, I am convinced, like we know, like this is called hyperscanning in the neuroscience literature, right? And we know there's articles out there that have shown that mamas with newborn babies, if mama plays with baby's brain synchronizes with mum's. So
Right.
again, it comes down to I think this is like the X factor in the chiropractic adjustment session, right?
Yep.
If you are in tune, if you are regulated, if you are present, if you can tune into your patient, then I think they'll get the best benefits from it. And I actually reckon we might be able to somehow get some measure of recording of this too, which I think would be really quite cool because you remember when you're a student and you're just following all these different rules, you're not thinking, you're not connecting, you're not tuning in, right? You don't get that until a bit later on, but maybe there's a bit of a measure for that, which I think would be really quite exciting to see. And there's also all these amazing stuff out there, like with these really severely autistic kids, how they can actually tune into their mum's brain and literally see the world through the mother. Like they can like watch a movie that she's watched like through her eyes. I mean, it's unreal. And they can like mind read and so there is a connection between human beings because we're social beings.
Totally.
We are so interconnected with humans. And a lot of this too is in that medial prefrontal cortex, Don. And then the connection to the small, more posterior parts of the brain where we create our own story of who we are and how we fit into the world. So, and it's literally these areas of the brain that we are documenting again and again and again that we change when we're checking and adjusting subluxations. I mean, it's quite unreal, isn't it? Like, people think research is boring. It's so exciting. It's not even funny. It's so exciting. I just can't believe someone that thinks research is boring. Like, they must be studying the wrong topic.
Well, if you can imagine, if you're trying to like find a drug for something and you try that and it doesn't work, and you try that and it doesn't work, and you try this and it doesn't work, or this has a mediocre work, rather than we just get more excited. Because like I always say, like the more I learn about it, the more excited I find more powerful what we're doing. Like it
Yeah.
actually just amplifies your like your kind of drive in what you're doing because it just makes more and more sense.
Yeah,
Like it's just
yeah. And you
so
see that there's more and more science out there that it makes sense to as well. We were having this conversation before we started as well. My amazing bioengineer, Imran. I mean, I've got a whole team of bioengineers. I'm just saying, if it wasn't for him, we wouldn't be in the position we're in now because again, he's attracted all the others. We have 11 AI experts now.
so
11
good.
freaking, and these aren't ChatGPT experts. These are the dudes that write the fucking code. You know what I mean? That
Right.
create these kinds of programs. It's that level of expertise. But anyway, this is how I actually got Imran to come to New Zealand because he was into this. You know how they in stroke rehab they're trying to pick up on the EEG when a person is thinking about moving, but they can't necessarily move like an arm or a leg because of their stroke. But you can pick up on those. It's called like brain computer interfaces where you can sort of pick up on EEG and actually, say for example, move a robotic arm or a wheelchair or a cursor on a computer, whatever. But he was into that kind of research. Super fucking smart guy, working with the top neurophysiologist on the planet for his PhD. I mean, Dario Farina, like oh my God. Anyway, so he was there just helping out a friend of his that was also there, who was a friend of ours. And Bernadette Murphy and I were there in Canada. And we were, by then, Don, and this was like over, this was almost 18 years ago. And like I had already by then, right from like 2012 20 years ago, I was seeing the changes in the brain. So for me, this was normal. But anyway, Imran was there and he was recording on the day, and he literally thought the electrodes had fallen off or that he had fucked up in some way because, they would be excited in their, brain computer interface world if they could get like 2% change, 3% change, they'd be delighted. And here from just a simple adjustment, we were getting 300% changes in brain function, and he literally thought that he'd done something wrong. And I'll never forget, he was looking at the computer and looking at me and looking at the computer going, oh my God. Whereas I was like just smiling away going, yeah, this is normal.
That is
And
so
then he
good.
came up to me afterwards and wondered, what on earth are you doing? Right? And he'd never heard of Cairo. And so then I lured him out to New Zealand for a trip, and he brought some students and we did some projects literally on the kind of measures that he was interested in.
Yeah.
And Don, I didn't even really know much about them at the time, but I knew they were brain-based. I was thinking, well, let's just measure them, eh? And I
Yes.
was even asking him, I said, so what would be a good outcome? And he goes, oh, well, if they're bigger, then it's easier to detect. I said, okay, well, we'll just see what happens. And they did all the recording, all of it, right? And they're bioengineers. They have no bias when it comes to Cairo. And lo and behold, we increased those, those MRCP measures after chiropractic care. And then later, like the science hadn't even come through at that stage. Later on, the bigger those MRCPs are, the better we know it correlates with our brain's ability to switch on our protective mechanisms, our protective spinal reflexes, and switching on our core abdominal muscles. And like I couldn't make this shit up even if I tried. I'm actually not that smart. Like, it's like I can't even keep up with the team. I'm like,
That's
so,
so
so
funny.
what's the latest findings? Oh fuck, I've got to go read that up now. Yeah.
Well, and it just shows you
Oh
the power, right? The power. What's funny because even in the polyvagal world, a lot of the people who initially start doing the polyvagal work are counselors, right? So they're counseling.
yes,
Some
yes.
are just body workers as well. And it's funny because he was talking about the power of touch. And so he said, for example, like shaking someone's hand, like because as a person, if you've been in a constantly dysregulated state, it's like your body doesn't really even know how to be in a regulated state because
No.
it's never been around someone who's been safe enough. So if
Yeah.
you shake someone's hand, that is the equivalent of spending 4 hours talking to someone who's safe. So
Wow.
that's how much it amplifies the regulatory effect by just touching by hand. And so when all these different practitioners are talking about what takes them months and months of co-regulatory activity, we do in like 2 minutes
Yeah.
as a
Well, we
chiropractor.
also put our hands on them and like little things like because it fits in with this positive psychology literature like Barbara Fredrickson's work, where they were showing that if you just look someone in the eye and your CAs can do this, it doesn't even need to be you, but if your practice sees like allows people to feel seen and heard, that alone starts to change shit. And you'll know that your CA team are doing a really good job with like just greeting someone by name. Oh, hi Cindy, I'll be right with you. I just, got to deal with this, but just allowing people to feel seen and heard. Like they start to report things like, oh, I was really bad, but then I made an appointment, and as soon as I made the appointment, like the healing starts to take place, Don.
Yeah,
Like,
totally.
and it's true. But you in your research, and your sorry research, you in your practice have created an environment that enables them to feel safe with you and your team, and
Totally.
that's part of this. That is because the healing starts. And if you're getting reports like that, oh yeah, it was really bad. But then as soon as I started to make my appointment or rung the office or thought about ringing the
Or just walked
office,
in the door.
yeah,
Yeah.
then you already start the healing journey. Because there is something there, and we know that. And again, it's just, yeah. There's so
So
much to research, eh? There's just like I need like, I don't know, 100,000 PhDs and like five different practices, clinics, research centers all over the world, and
totally.
God knows how many billions of dollars, to really do what needs to be done.
So
We'll
I was
get
going to
there.
say because we hadn't really had an update. Like an an ago, I had Dr. Kelly Holt on here, just like probably about
Did
two
you?
months ago. So we chatted about some of the stuff that was coming out, but maybe like, and I know you can talk about you have a call I think coming up in a couple weeks here, like 3 weeks.
I
Is
do.
it
I do.
in
What was I
March, right?
doing on that one? I think I'm doing the neuroimmune. I'm revisiting the neuroimmune. So I've got like what I call a masterclass. I just needed to give it a name. I mean, the early ones weren't called that. I think they were just called 2 hour online classes. But
Yeah.
now I've just called them masterclasses for the profession. If they just want to dip their toes in, like, because I also obviously I have a whole training platform and program. And so if people want to learn about the science, I break it down and slow it down. They slow my voice down too, because I get a little overexcited and speak a bit fast. And I realize that. Plus, we take the swear words out. So if
Oh,
you actually
that's
want to
nice.
learn,
Do they
I
do
have people
beeps? Do they
complaining,
do
Don.
beeps?
No,
Or
they
they
cut
just
it.
cut it out?
But I have people complaining. Why are you too proper in these classes? I'm like, yeah. Anyway, but yeah. So one of the upcoming master classes, I think in a couple of weeks, we'll get a link to you if I
Yeah,
haven't already
because
sent you
I'll
the
get
link.
this out before that comes out. And it's somewhere about the second or third week in March, I think. So
Yeah, it's coming up soon. But
okay,
anyway,
I'll put it in the show notes anyway, the link.
what I'm doing with that one is we've been doing again, our team's grown so big now. We have this amazing clinical scientist, and actually the study has been like a 12-week chiropractic care study plus 4 weeks follow-up. So it's a 16-week randomized controlled trial for
Nice.
one, which is almost unheard of. And we're doing quite a few different measures. One, we're measuring these brain networks, which I've done another masterclass on. So if you go on to my masterclass thing and you haven't heard of the triple brain network stuff, jump in there because it is mind-boggling, right? But what we're specifically going to be talking about this upcoming one is the neuroimmune changes that we got. And they're unreal, Don. I mean, it's just like, I mean, oh, jeez. Like even just something as simple as the brain-derived neurotrophic factor, that is like literally a measure of health
Hmm.
and longevity. So if your BDNF goes up, your health, your longevity has risen, right? Beautiful changes. And these people in this RCT, in this randomized control trial, they were not pain patients. So I'm not talking about just reducing pain. Like
Totally.
we're talking about adjusting the spine, improving its function, improving the brain body connection. And what are we finding from that? And it's just unreal. We've done a second one in teenagers as well, but we didn't withdraw blood from them because to get these neuroimmune markers that we're doing in the adults, we have to obviously draw blood and things like that. But
Right.
it's like, I mean, we must have done about 15 different measures, but the coolest thing is like, I mean, if you're doing 15 different measures, you could randomly have one or two be positive, right? Like
Right.
because that's the whole thing with significance at 0.05. It means in 1 in 20, by chance, it would be a significant finding. But it's like mind-boggling because it's like it's telling a story, and because this thing went up, but if it was meant to be this, then that thing should have gone up and it didn't. But so this went up, but it went up with these guys, and so it's really telling a story about like a real positive outcome about what's happening in the neuroimmune connection with our patients, which
Hmm.
it's just and the coolest thing, Don, is just like literally like 2 weeks ago, the same Imran Amjad is this amazing clinical scientist. So he's sort of in charge of our the clinical trial aspect of it, right?
Right.
And he's also, because of this neuroimmune connection now, he's gone in and looked at the the genes that turn on and off depending on what we're doing, a bit like Bruce's epigenetic stuff.
Yeah.
All right. So again, if you're under chiropractic care and we're looking at then what genes are turning on and what genes are turning off. And again, oh my God, we've literally just got the result. This isn't published yet either, right? But it's what's coming, and I just can't help share it because it's showing that we are improving our oxygenation use. We're also at the same time improving our antioxidant functions. Like, and again, it's not just one or two genes that's swaying the results. There's a whole orchestra of them. It's like this whole lot of genes that are all antioxidants are switching on under like a couple of weeks of chiropractic care. Like it's like and when you do that in different people, different populations, and it's
Yeah.
all telling the same story, like
Yeah.
that's where my
Powerful.
confidence comes from. I could speak in front of anyone. I don't give a fuck because I know my science. And that's not even just the theory or the philosophy, right?
Yeah.
I
Yeah.
just know what the science, I know what the facts are telling me.
Hmm.
And it's just unreal. So honestly, I mean, I know we've said this all the time, like it's such an amazing time to be a chiropractor, but it is an
It,
amazing time to be a chiropractor because these facts, they're coming out now. I think the bottleneck is me again, and I do apologize,
well,
but like,
yeah, we just need to
such,
like clone you a whole bunch of times to get a bunch of yeah.
well, I'm going to try and grow a few other chiros that, want to do neuroscience and can help, can help with all these projects because there's just so many now. I'm
Well,
literally sitting
it's so funny
full
because
paper.
that like with me doing my deep dive into the vagus nerve, and we have a little group, and so it's great because I have to learn a whole bunch of stuff I never learned about. But even just the vagal spleen inflammatory loop, like that thing is huge because if you're dysregulated and you have inflammatory markers and you have an inflammatory response, which would be any trauma, and then the vagus is 80% sensory. And if it comes back down to the body and detects that there's still danger or there's still problems, it just refires it. And then it just refires it. And then it
Yeah,
refires because normally it's supposed to fire and then just turn off. And so
yeah,
that inflammatory cascade, like that would be totally involved in that whole process too, right?
it
As
is
that drops.
because and thank you for raising that because I jump over like 10 steps because what we know is it's very well known how the central nervous system and the immune system talk to each other. So we know the exact regions in the brain that are involved in sensing what's going on in the body, like you're talking about,
Mhm.
and we know the exact regions in the brain that send messages back to the body to control it, right? To
Mhm.
increase or decrease inflammation and all these different markers that you're talking about, right? And now we know with chiropractic care, so here's the body, here's the brain, and then here's the spine. Now we know with chiropractic care that we already by now have evidence that we're probably that no, we already have evidence by now that we're impacting at least 75% of those brain regions that are important in sensing what's going on in the body and controlling what's going on in the body. Because that's another talk that I gave a masterclass again. If you want to look at what the organ function one, and
Yeah.
that's on that same masterclass link if you wanted to, because like some people still think that we're affecting the nerve roots, right? So they
Yeah.
think we
Yeah.
have to adjust at that level to
Yeah.
affect that organ. That's not the case because it's the subluxation that wakes up the brain and all these important brain regions that sense what's going on in the body and control it. And a lot of that is the hypothalamus pituitary adrenal axis, which
Hmm.
you know all about through Podgers's work.
Yeah.
And it's the vagus nerve, the sympathetic nervous system, and the parasympathetic nervous system. And they go both ways, right?
Yeah.
So you've got sympathetic senses and you've got parasympathetic senses and you've got sympathetic activity and parasympathetic activity. So that those two are the two main regions. So via the blood or via the autonomic nervous system or via the spinal nerve roots as well. Because again, around all of our organs and all around the body, we have the mechanoreceptors and, like pressure on the heart, for example, that would also go. So they're the three pathways that connect the body with the brain.
Right.
And yeah, and we know now, like this is where I have to do the master classes. I have to record them because
Yeah.
there's just too much to talk about. We'd never finish. Like we'd be here 8 hours later and we still weren't into all of it. But this is where it gets so exciting, Don, when you start reading about these brain regions that we now have documented evidence that we're changing. It's mind-boggling. But what we're picking up on is a lot of these multi-sensory integrative areas where the body has to integrate what it's hearing and seeing and feeling and sensing inside our organs and our pH levels and our oxygen levels and our emotions and how stressed we are. And then what the brain starts to decide for you, is this important? Is it scary? Is this a threat? What should I do about it? These areas in the brain are the areas that we're impacting
Hmm.
because it appears that the brain needs to know where it is. Where are you? Where's the core of your body? And we think that's why the spinal proprioceptive information is such an impactful signal into this system. And that makes total sense. Like if you think about, well, how is the brain meant to know where a sound is coming from if it doesn't know where it is?
Right.
Right?
Yeah. Yeah.
You need to
100%.
know where you are to know that the sound's coming from over there.
We call it worst point zero.
Yes, where's point zero? And that also explains why arms and legs are so very much impacted by spinal subluxations. Because again, where do your arms and legs attach? Duh.
100%.
They're attached to the core, to the spine. Whether it's, via the ribs and collarbones and all of that, but they attach to the spine,
Hmm.
in essence, or the pelvis,
Well,
which is
this
why.
is, well, I was just going to say this is so cool because then I'll just say this is the other thing is interoception, another concept in the polyvagal theory. So what happens is when the body is overwhelmed with a threat response that it can't deal with at the time, our brain will dissociate from our body.
Yes.
as a protective mechanism, right? And so
Yes.
this is chronic stress over time. So people
Yes.
are deliberately, or well, not deliberately, their body is as a protective mechanism decreasing interoception, which is
Yes.
decreasing our awareness of point zero, which decreases our ability. That's why even with
Yes.
proprioception, we don't even know our bodies in space, let alone who we are. Because I like when you're
Yes.
talking about the mode, the three, what's that? The
Yeah, the
brain
default mode
default
network.
modes, because that's
Yeah.
like a better sense of self. Because a lot of people, if you ask under chiropractic care, they feel more confident in themselves because they actually
Yes.
become more connected to themselves because it improves interoception.
Well, some of the research that we've found literally on the whole, brain model of chiropractic care and brain model of subluxation is literally this work by Lorimer Moseley and David Burke and these phenomenal neurophysiologists again, phenomenal, right?
Yeah,
And they're literally talking about that if you come under threat, right,
yeah,
you go into fight and flight, the brain, it just switches off the communication from the small paraspinal tissues because it's not, the precision is not so important. You need to get ready for fight or flight
totally.
to get out of the danger.
Yeah,
And so it fits in exactly with what you're saying there. So that's the evidence that I rely on. That what causes a subluxation? Well, we know physical injury based on all of Paul Hodges' work and all of that. That like a huge group there that doing that, based on Lorimer Moseley and David Burke's work on fight and flight. We'll also switch off the communication. So there's another second reason. And we've also found evidence in the literature that local inflammation. So I don't know. I mean, someone came up with some way of explaining what a subluxation was, trauma, toxin,
yeah,
thoughts. Can't
physical,
remember who
chemical,
that was.
emotional. Yeah, totally.
Yeah, yeah.
All
Physical,
that was all
emotional,
quackery.
chemical
Don't forget.
trauma turns off the subluxation. I
Yeah.
mean, literally creates that subluxated state where, in a way, you are dissociated from what's going on in the spine and the rest of the body.
And
And
actually, and
it,
what one of the because it's sorry, I would interrupt. I would get too excited about stuff, but like I just started just kind of modifying some of my adjusting. So I'm doing like we're just going to England this week, and then we're actually coming to Australia in a couple of weeks. Just doing the shoulder pelvic floor because and
yeah,
again I'm remember the old research you did on the pelvic floor. So I got
I know,
those in
I
my
know.
PowerPoint slides. Those are great. But the thing is that since COVID and everybody got like shut at home and shut down, so the two stages of threat is the sympathetic inaction threat, and then there's the
Yeah,
dorsal vagal frozen in threat.
yeah.
And because so many people are inactive, they're actually in a shutdown state. That's why when you said it fires the sympathetic nervous system, that's really cool because a
It's
lot
actually
of
a good thing.
people, yeah,
Yeah,
because if people are dorsal, they get adjusted, they get hot, or sometimes they feel a little bit
yeah,
nauseated, or like they're
yeah.
just like sweating because it actually wakes them up. People that are like crazy stressed, they get adjusted and it actually calms them down. And people that are dorsal, it actually wakes them back up. So it's like pretty
And,
cool.
and can I jump on that? Because
Yes.
this is where the triple network gets so exciting. Because what we know as neuroscientists now, and when I first learned about this about 15 years ago, I was like, what the fuck are you talking about? Because what they were saying is, I just thought that, with a neural plastic brain, like sensory input and it's changing all the time. No, it's not. Because it is actually so exhausting, energy consumptive wise, to actually pay attention to what's going on inside you and around you, that you go into a story. And the brain's story about who you are, what's going on inside you and around you is far more powerful, which is why when someone has become chronically something,
Yeah.
it's in their default mode network, their story about who they are. And if you can't enter into that story, like you can't change it, which is why chronic problems are so difficult. So this is why the salience network is the network that wakes the brain up. It's
Yes.
part of the sympathetics, right?
Totally.
But it's like, for example, if a fire alarm went off, it's just a sound, but it's a sound that wakes the salience network up that goes, get me out of here right now,
Yeah.
right?
Yeah.
Right? And it's the same thing like if you had irritable bowel syndrome and you suddenly felt like you needed to go to the toilet. Again, it's just a sensation from inside the body, but it wakes the brain up of someone with irritable bowel syndrome. It's, I got to get out of here now, or I'm going to shit myself in front of all these good people, right? You don't
Right.
want that. But
Yeah.
it's just a sensory signal. So we think the adjustment is exactly that, Don, that you're literally waking up the salience network and the brain's going, shit, what's going on? Right. And it genuinely pays. And I think this is why patients get really tired after an adjustment.
Yeah.
And because of the rewiring, we know that if you're going to make changes in your system, what has to happen? You have to have sympathetic activation, you have to have focused attention, and you have to sleep.
Yeah. You need
And what's
recovery.
the
Totally.
number one change we get reported from patients is they sleep better.
Better
And,
sleep.
and that's when they're processing these changes that their body has now adapted. So again, like I'm getting into sleep research with again Professor David White. He's got all of these. He's this non-chiro professor that's joined our team, and he's got all these connections with sleep experts and autonomic experts and microbiome experts. I mean, oh my God, 25 years ago when I went to neuroscience conferences, no one at a neuroscience conference spoke about the gut. It'd be off you go to the gastrointestinal conference, like you've got nothing to do here. Now, when I go to neuroscience conferences with 35,000 neuroscientists, like the Society for Neuroscience,
Yeah.
massive events, right? And you can't go to everything. So you're going to decide what you're going to do in your 5 days. You're going to set your schedule and you're just about running from session to session, right? While you're there. I could spend my entire 5 days just going to sessions on the microbiome and the gut and the incredible impact it has on the brain. So things like gut instincts, don't knock it. That you've got
100%.
more neurons in your gut than you've got in your spinal cord. And if you change the brain, we know we're changing the microbiome. So again, like when I first started talking with David White, I was just about drooling. Yes, come work with us, please.
Well, it's so funny because I read the book, The Second Brain, and so
Yeah,
I did a call with our group on that, and it was funny because the researcher that discovered the second brain was back right around the same time chiropractic started, and the funny thing is that nobody liked him. So as soon as he died, they actually buried his research for something
really.
like 40 or 50 years. And the guy who wrote The Second Brain just uncovered it and found out that it just basically went into the dark ages of studying the gut. Like
Yeah,
it's so
yeah,
funny. It's just like it's kind of like chiropractic, right? They're like they just didn't like him, and so then they just
yeah.
paused his whole research, even though he was onto this like back in the end of the
It's a
19 or
massive thing.
1800s.
But it can be threatening to other scientists that maybe have built their career around something. So I always say that because people come up and they get so angry with why aren't all chiropractic scientists like so pro this research? And I said, well, look, guys, like, people might have built an entire career around the mechanistic, treating pain through spinal manipulation. That might be their entire career. It's not easy to make changes. And remember, neuroscience is very different than, say, biomechanics that maybe, they built their entire career around, or
Yeah,
epidemiology, or whatever they've built their career. So, like, just forgive people for not managing to expand their brain to, a
totally.
complete different area. It's not easy. Plus, but it is doable though, because in the early days of my research, I still thought that it was going to be,
Yeah,
spinal
segmental.
cord,
Yeah,
segmental stuff. But
foot
right
on the
from
hose.
our first ever PhD research studies, we didn't see changes at spinal cord level. We didn't see it at brainstem level, but we had these lasting changes in the brain. So
Mhm.
Bernadette Murphy and I had to completely rechange our model of what was going on. But like it was within neuroscience. So like, that's probably why I could do it because it was within my own field, you know?
Right.
But I'm now going out there saying I think most chiropractors are underservicing their patients. I
Yeah.
don't think they're adjusting them often enough and for long enough.
Hmm.
But again, that's based on the data of what I'm seeing. And to begin with, Don, I used to think that we overtreated people and all this. I grew up in the medical model, but
Yeah.
now the data is telling me a very different story. And I really enjoy sharing that with people because even if I can give the chiropractor a little bit of confidence that you're doing your patients a service,
Yeah.
if you can see them a little bit more often, because this isn't something that can be altered in 5 visits. Like we know from exercise physiology literature that if we're actually trying to change the physiology and the morphology of these paraspinal muscles that have atrophied, shrunk, fatty infiltrated, become stiff and fibrotic, change their fiber type, change the morphology of the muscle spindles or stretch receptors themselves, that isn't going to change in 5 visits. Like,
Totally.
and one adjustment session is more than one exercise session because you free up the movement. And so you get, and this is where the clinical art comes into it,
Yeah.
when they're back into that same pattern that they were in,
Yeah.
so now it's not working again. So now you've got to free that back up again and get that moving again.
Yeah.
But it's going to take time and repetition. And what we're talking about we know from the exercise physiology literature that the first 4 weeks of any exercise program, we know that there's no morphological changes to the muscles themselves. None.
Totally. Yeah.
4 weeks. So
Mm.
what's
Wow.
changing in those 4 weeks is the drive from the brain, the pathways back to those muscles, the
Yeah.
neural connection. So in the first 4 weeks of any exercise program, and I now say that I think we are exercising the spinal segments back into proper function. We're exercising the paraspinal tissues. That's the role of the chiropractor is to exercise those muscles back into functioning so they can then properly communicate with the brain so the brain can accurately know what's going on and control the system better. Well, that's going to take more than 4 weeks because so we're talking like probably 3 months minimum to begin with, right? And we even know from the clinical research evidence that the more frequently you see someone in the first 6 weeks, the better results that patient has clinically up to a year later. Only 6 weeks care. But like Mitch Haas has done this amazing research on that, both in low back pain patients and in cervicogenic headache patients. In the cervicogenic headache patients, it was like linear. Like, so one of the problems is with, well, what about 4 times a week or 5 times a week? That wasn't tested. But
Right.
once, twice, second, third, up to 3 times a week, they had like one headache less per month a year later from 6 weeks of care. So we know, and then you've got Eklund's maintenance care study from Sweden showing that those that respond well to chiropractic care in the early days, this was again in low back pain patients, if you follow them for up to a year, if they responded well, and you then say, half of them were told to come back when they hurt, and half were told to come on a maintenance schedule, they were seen about the same time. Like the maintenance schedule might have been seen once or twice more on average a year later.
Yeah.
But the guys with the maintenance care had 14 days less pain. 14 days, that's 2 weeks less pain. So again, it fits beautifully with this that we're exercising the muscles into proper function. So yeah, if you stop, well, you're just going to decrease your function again. And this ties in on so beautifully with this neuroimmune markers that we've got, because some of the immune markers that we've been measuring can either be an inflammatory thing or an anti-inflammatory thing that actually reflects muscle healing. And if it was inflammatory, then that IL-6 would also have an increase in CRP that's released from the liver if it's a pro-inflammatory thing that they're fighting off. Well, the CRP thing didn't change. So what else could IL-6 be? Well, it can be a myokine, which is this marker of muscle repair and healing.
Wow.
And so I've literally got it in the paper there. Like you can read it in the paper where I'm arguing then that we are literally repairing these paraspinal tissues when we're adjusting the spine. And that's what's changing over multiple weeks of care.
That's so cool. Actually, we had a couple clients who we were talking to, and the biggest the limiting belief we're trying to get them over is they were told when they're younger chiropractors that if you see someone too frequently, you're a bad chiropractor. So they actually were telling them the exact opposite of what the research is showing. So this is great.
But that's what I thought too, though, Don. That's what I thought too. I thought we were over-treating people, and if you're not good, you should fix them in a visit or two. And I'm like, no, 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 no. No, no, no. You can have remarkable changes in a visit or two because you've woken the brain up and the brain's recalibrated, reset all these different programs. And like all these remarkable things can change. We know that. We've seen that in practice. But there is something in like rehabilitating that spine too. So, and I know people don't like rehab as a word, but you that's our role. Like otherwise you're getting them good, like they've been exercising for 3 weeks and they're feeling good, and then you're just telling them now you can stop. Like it doesn't work that way, Don. Like it's you've got the spine functioning well. We have to. And again, I don't press anything down on a patient. Like that's where evidence-based practice is beautiful. I'll tell them the science, I'll tell them my clinical expertise, and then I'll shut the fuck up and go, what's important to you? If they don't want maintenance care, if they don't want ongoing care, that's their choice. And that's okay. But I enable them to come back. I said, no worries, mate. I'll see you when you're all fucked up again. I'll be here. And, like it's okay. It's your health. If you don't want to, work on it more, that's fine. You might have other priorities. Maybe you're going through a divorce and it's just too much shit going on to cope right now. And you're at least out of pain. I get it, right? But if we don't share the truth with them, if we don't share the science that says you'll be in more pain and you'll be back sooner than you really want to be if you stop now, but it's your choice. And that's the beauty of it. That's the, evidence-based practice model the way it should be. I know it gets bastardized. I know it gets abused. So don't get me wrong. I'm well aware of that. But see, I know enough about science that I can shut someone like that down anyway. So.
Yeah, no. And I was going to say too, this is actually good for chiropractors too, because like even if you're adjusting someone who say their range of motion is not as bad, their tissue health is better, and they're not as fibrosis, and they don't have as much like fatty infiltration of the muscle. Like that's why you get some people who respond so much quicker. than the other ones because and just being able to notice the difference between those tissue types.
And it makes sense, right? And
Yeah.
this is why I think it's so important that we chiropractors realize that a subluxation that starts today is very, very different than a subluxation that's been there for a couple of years,
Yes.
right? So if a subluxation starts today, I am quite convinced it's mainly a neurological problem, a neurological unaware of what's going on problem.
Yeah.
But if that's left on, then that's when you get all of these downstream maladaptive plastic changes. And even within the spinal physiology literature, they don't talk about that as pathology. They talk about it as maladaptive, plastic changes, negative adaptive changes.
Right.
That's literally what they call it. Just like us, right? We don't call subluxation a pathology. We
Yeah.
call it a disruption in the brain's ability to be accurately aware of what's going on and control the body at its best, right?
Yeah.
And so if you're just dealing with a dysfunctional neurophysiology, you can probably get them functioning well within a few visits, right?
Totally.
That makes sense if they're under regular care. You can get them right and they can go back onto their maintenance schedule. But if you're starting up a person who like might have had a car accident 4 years ago and they had whiplash injury, you just know you've got all these muscular changes, physiology changes. And so that's the person you sit down with and go, now, right.
Yeah. This
This
is
is what
going
we
to
know
take some
happens
time.
in the spine over time, but this is influences your brain. So we know there can be all sorts of other symptoms. So as we start working on you, and my recommendation is at least 12 weeks to begin with, and I can talk about why that's good for you and what the studies show. And so it's not just, my opinion, this is based on scientific studies. But what I want you to be aware of too is that changes can come over time. So you might notice a few things early on, and then you might notice a few things a bit later, about right 8, 9 weeks of care. You might suddenly notice things at 12 weeks of care that blows your mind away. That like because and again, that's where we come back to Kelly Holt's PhD. I mean, it's just gold. Like he showed that in the first 4 weeks of chiropractic care, that there was no real changes between the chiro group and the control group. These were older adults, 60-year-old
Yeah.
adults.
Was that with
It,
the step, like
the stepping task.
the
Yeah.
step? Yeah.
But they had changes almost immediately by the fourth week. They were more accurately aware of where their ankle joint was, and no chiropractor adjusted an ankle, right? They were more accurately aware of the sound visual illusion, right? So those perceptual changes come quite fast. But if you've got a complex task like this choice stepping task, where they had to pick up on the light, whether it was on the right or the left side, whether they had to step forward or to the side, there's some complex perceptions, decisions, and then actions, right?
Yeah.
That's yeah. No difference at 4 weeks, massive difference at 12 weeks. Massive.
Yeah.
Like more than 6 months of exercise programs have been shown in previous literature. Like, so this is where, because there's all this change in the physiology of those muscles, it's going to take time. And those changes, clearing up the brain, it takes time. And this is where because I know, because we talked about it, that people that are under years of chiropractic care too suddenly start to get these changes that aren't even thought physiologically possible. And that to me is like, I just get goosebumps. I just think it's beautiful. We're uncovering what's going on.
Yes. No, that's so true. I call it movement momentum. So I always talk about if the spine's been stuck, because I'm trying to use their
Yes.
the language they'd understand. That it takes a while to get the momentum, and then when the momentum is good, those would be the people that if they were subluxated, they respond a lot faster than the people who've lost all their movement momentum.
I grew up in Norway, so you'll get this in Canada, right? It's like the snowball effect, right? Have you ever
Yeah,
tried
yeah,
pushing
yeah,
a snowball? Yeah.
yeah, yeah.
And you push it up the hill and it just gets heavier and heavier, and then you get that downward effect and it just takes off. Because that's the beauty of the adjustment, that once you get the muscles functioning again, get them communicating with the brain again, that it almost takes off a life of itself and you hardly need to do anything. It's just like, oh, we'll direct it in that direction. Oh, I might
Yes.
go in that direction, right? But it's just like, it's just unfolding like a
That's when I
snowball
teased
rolling
him. I
down.
said, I almost suggested you with my mind there.
Yeah. No, don't you joke about that,
No, no,
Don.
that's
Don't you joke
true.
about We're testing that right now. I actually think that there's something in it. I don't know about you, but I reckon
Yeah.
I know for a fact I can tune into people's physiology because I can feel what's going on for them in my own body. And I don't know if that's mirror neurons or whatever, but I'm also very, very convinced that we can influence our patients with our intent. And that's part of what we're looking at with the hyperscanning study, where we've got whole head EEG on the chiropractor and the patient. I'm quite convinced. Do you do muscle testing at all? I can't
No, I
remember.
don't. No, I don't do muscle testing.
See, I do. And
Yeah.
I honestly think that muscle testing, we've done another study on the muscle testing now with high density, like 64 channels of EMG, where
Yeah.
you can, like, you know how with whole head EEG, we can deconstruct and find out where in the brain the changes are coming from?
Yes.
You can do the same thing with EMG. You can deconstruct down to the individual motor units. It's unbelievable. This is like cutting edge, bioengineering, biomedical engineering research that can do this. I can't do this. I'm not that smart, but the bioengineers we've got, they can do this, right?
Yeah.
And you can deconstruct right down to, and we know now that there are changes in recruitment when you've got a strong muscle versus a weak muscle, right?
Hmm.
And I've always used this because to me, it's like a communication with my innate to the patient's innate to find out, well, what should I be doing for this person today? And it's just so cool. Again, like, and I know there's probably some AK practitioners out there or
Oh yeah.
SOT practitioners that use the muscle test or, and like it used to be thought of as like airy fairy bullshit. Well, no, it's not. It's just
Yeah.
that we haven't discovered the physiology of it yet. Well,
Right.
we just you wait. There's papers coming now that show that there is a change in the recruitment of the motor units when you're doing a muscle test and a therapy localization or a challenge or like so whether the patient's touching, say, a subluxated segment or the
Right.
chiropractor's touching a subluxated segment and
Totally.
testing the muscle test, it changes. So there is an interplay. So it becomes a communication pathway, more than it is some airy fairy,
That's cool. Well, and again,
thing.
because a
And
lot of
it's
stuff that makes sense too, right? Like if you push something further into a subluxation, that's a threat response, and the body's going to not recruit muscle as a protective response, right? Compared to if it's strong.
exactly,
But it's just nice that you can
exactly.
measure it. Like,
I know, I know.
yeah,
But that's the beauty of the research, though. And again, I can't wait to come to Calgary and because I'm going to be sharing a lot of this, obviously, from stage and interacting with everyone that's there for the whole day. Like I'll be there the whole day. So, it's so cool. And I really enjoy talking to practitioners, like you, Don, that
yeah.
you practice, but you're a bit unusual because you also think, and I am,
Well,
I'm not teasing the rest of the
sometimes you
profession,
should ask
but I
Brandy. I
am,
don't know if she would agree with you all the time.
But it's very easy to get into just a pattern, right? And I think
Yeah.
that's one of the beauties of the events like the Lyceum that we're going to have, that we can get together and we can talk.
Hmm.
Because you have so much knowledge as a practitioner and you see things, right? You're really a experimental scientist, as a practitioner,
Hmm.
because you think about what you're seeing and what you're observing and what changes and what doesn't and what might be going on and then you go and read about it and you really are a researcher in your own mind. It's just an observational researcher.
Yeah.
Whereas I just design the studies where I can pick apart, whether it's because you can't, unless you do the clinical trials with the control groups, you only see what the people that come back to. So it's
Totally.
like if it didn't work and they never came back to see you, they might give you a reason that they're moving or whatever. But like, so this is where sometimes the other designs. Another really cool thing that we're getting into now, Don, is looking at big data. Because what we want to do, and
Oh
I don't
yeah,
know if
through
Kelly
AI.
got into that, we want to start electronically pulling, because again, we've got 11 AI experts here. We want to electronically pull your electronic health records from, then we could get millions of patients from thousands of chiropractors. And I think there's so much gold in real chiropractors taking care of real patients and us being able to look at that. Because one thing we notice in the clinical trials is like, we're only measuring X, Y, and Z. Well, some of these patients that are in these clinical trials, they start writing us letters. They had changes in S, T, U, V, like all these other changes. We weren't measuring that. But
Right.
in big data sets, if you allow your patient to tell you all these various changes, if
Yeah.
you suddenly find that a million people that see chiropractors that get this done to them, a million of them have this change, well,
Yeah.
that's not
That's
a coincidence.
that's important data.
There's
Yeah.
there's real data, and you saw that probably through the COVID pandemic too, that some of this real data from, big people, how they
Yes.
did these models and they fucked up the models and the models were nowhere near accurate.
Totally.
And they saw that in the real data, you see. So that's another thing that's just so exciting moving forward. Kelly Holt is just like almost ecstatic about this stuff because then we're also trying to build like a really good back end so that we can pull your electronic health records. But like in a chiropractic way, I was having this conversation with a chiropractic student. Why not just use medical electronic health records systems? And I'm like, well, they don't really even acknowledge that you could be subluxated. And wouldn't it be
Yeah.
wonderful if you could just click a couple of buttons that, they're subluxated here, here, and here, and according to these listings, because we know that you're using SOT, or you're using, the
Yeah.
Gonstead listings, or you're using whatever, Blair
There
listings,
has to
whatever
be
you're
an
using.
analysis to know it's C2 left or something, right? Like you have to
Yeah, yeah,
like
yeah,
figure
yeah.
there's analysis. Yeah.
Yeah. And you don't want to have to scribble that down every time. So imagine if you just click a couple of buttons. Oh, yeah, they've got this, and this pattern. The other cool thing from that is you can see patient patterns
Totally.
because it will all be there. And the AI can tell you, oh, this patient has been in this stack pattern, but suddenly if something's happened because they've really shifted, maybe ask them what's going on. Like there's so much value in us having chiropractic specific, you know, electronic health records and technologies, or even if it's just an app, because you don't want to change your electronic health records. I get it. I mean, I don't want to change systems ever because I fucking hate it, because
Yeah.
but you know what I mean? Like there's multiple ways that it can work in with what you've already got too. But so that to me is a really exciting thing coming up in the future that we're working on real hard now to get. Because again, like, do you think there's a study on the planet yet that's looked at clinical indicators of subluxation over 16 weeks of care?
Yeah.
No,
No.
no, but we just have now. And funnily enough, one group, I'll say group A,
Yeah.
has no changes in the amount of clinical indicators for the entire 16 weeks. Group B, however, it has a big drop off. Oh, I wonder which group might be the chiropractic adjustment group.
Yeah, we
And
don't
imagine if you could then mirror that up with the clinically, that we can feel clinical indicators of subluxation, and mirror that up with, say, spinal MRI images of the fatty infiltration and the morphology of the muscles, and see that those things correlate. I haven't done that yet, but that's like my dream project to be able to look at, because then it's sort of full picture, right?
yes.
Then full cycle.
That'd
So,
be great. Good. Oh my goodness, we already got to the end of our time. That we could be, like you said, we could talk for 8 hours. But I'm super looking forward to seeing you in Calgary. That
oh, I
it's
can't
going to be
wait to
so
see you
good
guys.
in real
Yeah.
life. Just at the end, you want to leave any words of inspiration to the chiropractors listening out there today? They already should have enough inspiration, but one
I
last
mean,
little drop.
honestly, the way this research is going, and like we're growing so big, 35 research staff members. I mean, most of them are non-chiropractors. They don't have the bias. This is it's just like it's mind-boggling. And the interconnections now with the neuroimmune and the genetic changes and the all these brain changes, because we've done 3 clinical trials now looking at these brain changes within that triple network system. It's like, I'd challenge you to learn your own science, own your own science, because it's becoming such a powerful tool, especially if you're in this sort of brain model of chiropractic, the nervous system subluxation model of chiropractic. It just is such a perfect fit that it's not even funny. So where all this science now is backing you up. So
Yeah.
learn your own science and use it. And there are so many ways to do that. Jump on some of these masterclasses, come to conferences like the one in Calgary. We've got whole bloody libraries for you where you can learn, and we've got patient materials too in Kairo's Academy and Kairo's Hub, where you can share some of this scientific knowledge with your patients without you having to remember all the details. It is such a beautiful time to be a chiropractor. And I'd like you to leave with that, make sure you're looking after yourself, because if
Yeah.
you're not adjusted and regulated, again, I have people go through, like, say, the stuff that I'm teaching, the science of this, and I have chiropractors coming to me afterwards saying, Heidi, I am getting adjusted more regularly because of the science. I'm seeing now the value in it. Like, imagine how that's going to change your certainty and your, confidence in communicating the benefits of chiropractic to others. I am getting checked more often.
It's
So
funny,
look
just
after
on a note,
yourself.
I was going to say on a note on that one, we had just done our first program calling Healing the Chiropractor in Phoenix last month. And so we just
Yeah,
wanted chiropractors to come and we just looked after them. And it
yeah.
sold out like in 4 days, and everyone was like super happy because we actually just looked after chiropractors because
Yeah.
they don't get adjusted enough, and
We don't.
we need, yeah,
We actually have to prioritize it. I even also pay for my own care now because I'm doing more and more communication with the public, and I don't
mm,
want to ask them to do something that I'm not willing to do myself. So I pay for me, my husband, my 2 adult kids, my staff members as part of Warwick Research. I make sure the whole research team gets adjusted through the college, and I pay for my care and my family's care and my staff member in my own company, Warwick Research, because it's a priority to me because of what I know.
yeah,
Yeah, I challenge you chiropractors, look after yourself, get adjusted more regularly. It's, yeah, if you don't feel the benefits yourself, that the truthfulness, the authenticity, and the confidence isn't going to come through you.
Hmm.
And it shines when it's there. It shines. And you just attract so many people, it's not even funny.
That's
So I'd
awesome. Well, thank you
leave
for
it on that
so,
note, eh?
thanks for coming on the show. I love it. It was great.
Thank you for having me, Don.
And
And I'd like to do this again. And
yeah,
lots of love to Randy too. Yeah.
100%. And we'll especially now, like before I wasn't actually diving as much into it because I wasn't teaching technique and all that stuff. So I had less to contribute. But now I'm learning a lot more. So then I'm also more interested. So the more you learn you don't know. And then I'm like, man, I gotta learn more. So
The more you learn, you don't know. And I've even started now what I call a platinum membership, where I literally work with you guys, and so set challenges, little online classes, and then live sessions every couple of months where we literally dive into it. It's so wonderful because I get so much out of it too. Just again
Mhm.
talking to the practitioners. But anyway, I could literally yak on forever, so I'll shut up now.
Okay.
So
Well,
lovely to see you, Don. Thank you for
yeah.
having me.
And we'll see you soon. And everybody else, hope you guys have a great day. We'll see you guys in a couple weeks.